Assalamualaikum warahmatullahi wabarakatuh. I am Aureli from Faculty of Medicine, General Ahmad University, as one of the author for the research with the title "The Relation Between Diagnostic Delay to the Incidence of Perforation in Patients with Acute Appendicitis at Rumah Sakit Dusira in 2017 to 2020." This is the abstract of the research. Acute appendicitis is an inflammation of appendix leading to perforation with prevalence reaches 30 to 70%. Mortality rate of perforation multiplies 3.5 to 10 times, so it is necessary to diagnose perforation pre-operation. Research was conducted at Rumah Sakit Dusira in 2017 to 2020 to determine the relationship between diagnostic delay to the incidence of perforation in patients with acute appendicitis at Rumah Sakit Dusira in those years. Research used medical records on patients more than 18 years diagnosed with acute appendicitis and underwent appendectomy at Rumah Sakit Dusira. This was an analytical research with cross-sectional approach, while the data was collected using non-probability and purposive sampling. With the incidence of appendicitis in Indonesia reaches 10 million per year, the highest throughout Southeast Asia, and in West Java in 2013 recorded 5,980 patients with acute appendicitis with 117 deaths. Acute appendicitis is mostly caused by lumen obstruction such as fecalith, lymphoid tissue hyperplasia, foreign body, and parasites. The obstruction of the lumen leads to a rise in pressure, occluding arteries and veins, which will cause infarct, gangrene, and perforation in 20 to 36 hours after the first sign arises. As the mortality rate increases, it underlines the importance of pre-operation diagnosis of perforation. The only accurate treatment option after a patient is diagnosed with acute appendicitis is appendectomy. Factors that commonly play a role in the progressivity of appendicitis into perforation are the presence of fecalith and lumen, age, and diagnostic delay. Previous research in 2018 showed the risk of perforation increases 1.75 times with system delay for more than 12 hours and no rise with diagnostic delay for more than 12 hours, which is the reason why the authors decided to group the diagnostic time into more than 24 hours. The objective of the research was to determine the relation of diagnostic delay to the incidence of perforation in patients with acute appendicitis at Rumah Sakit Dusira in 2017 to 2020, and whether there is a difference in diagnostic time between patients with perforation and without perforation. Results showed in the table, which were obtained from 34 samples from medical records of Rumah Sakit Dusira and analyzed in univariate and bivariate, concluded in the table. 80% of patients with perforation underwent delayed diagnosis, and 50% of them were not delayed, while 20% of patients with no perforation are also present with a delayed diagnosis, and the rest is not. The p-value, which were obtained from Fisher's exact test, was 0.229, which is more than the alpha value, implying there is no relation between diagnostic delay to the incidence of perforation in patients with acute appendicitis. Then for the next objective, research used Mann-Whitty test, which was based on the normality and variety test with p-value 0.984, which is also more than the alpha value, indicating there is no significant difference between diagnostic time of patients with perforation and without perforation. This may be due to research limitations, which were diagnostic time reported in most medical records were not detailed and precisely mentioned the time, and patients with perforated appendix were significantly more than without perforation, or 3.25 times. The conclusion of the research was there is no relation between diagnostic delay to the incidence of perforation in patients with acute appendicitis and no significant difference between diagnostic time of patients with perforation and without perforation at Rumah Sakit Dusira in 2017 to 2020. These were the references used for the research. We are very grateful to Faculty of Medicine, General Ahmad University, and for those taking part in the research. I thank all the viewers and for those paying attention to the research, and I also thank the other authors for the opportunity to present this research. Wassalamualaikum warahmatullahi wabarakatuh.